Hi guys, so I'm back. It's been a while since I've made a video. I had my standard first follow-up appointment for transplant, which legally in Switzerland has to take place every 3 months. And that's what my last video spoke about. And then I was invited by the counselling service to come to a patient education session. And so that occurred on the 30th of January. It's now the 2nd of February, so it was 3 days ago, I think, 3 days ago. And essentially the counselling service did an hour and a half with me, talking me through the process of what's going to happen before, during, after. So I took a little notebook with me, which is here, and I made some notes here. So you should be offered a counselling session or an education session if you're on your transplant list. So just ask your centre about it if you haven't been offered anything. So I can't go through everything because it was about an hour and a half session, but I can kind of try and talk you through a little bit about what they told me. So I was given a lot of information at my appointment on the 30th in German, but in that booklet there's a couple of tables which show you different symptoms. They have green, which is what's okay, yellow, which is something that I need to check and monitor, and red is when I really need to take myself to hospital. So those were really good to find out about, and I'll get my boyfriend to go through them in depth with me, but they were things like for hepatic encephalitis, for ascites, for any kind of temperature that I have, what I should do. They told me about the possibility of getting psychiatric counselling for my boyfriend. So I'm offered these because, you know, I'm going through a transplant. There's a lot of emotions, a lot of things that have to be dealt with. But my illness doesn't just affect me, and obviously my partner has to go through all this with me, but everything's about me. And obviously it's very tough for your loved ones, your partners, and I know that I'm guilty of forgetting sometimes that as hard as it is for me, it's just as hard for him. And so apparently he should be able to also get psychiatric counselling, which should be covered under his insurance. It's not covered by my insurance. So it's something we might look into. I need to talk to him a bit more about it and see if it's something he wants to do, because obviously it's his decision. But that was one thing they talked me through. The next was about accommodation for family in Zurich. I obviously don't live in Zurich. My family live in England, so they just told me who I can contact to help arrange for accommodation if my family have to fly over or something like this. So that was a useful practical thing. They told me that there is a website called easl.com, which I think is the different symptoms I can expect for transplant, and it's in English, so if those tables I was just talking about, there should also be a lot of information on that website, so that should help you if you don't have a counselling session. So again, it was easl.com, and I'll put a link in the description box in case you need that information. The other thing they told me about was that I will have some rehabilitation after transplant. So the process for transplant in Switzerland is that you have the phone call, they tell you that there's an organ, and then the ambulance comes to collect you. You go, you have your transplant, hopefully that all goes well, and then it's 4 to 5 days in intensive care. And I can do a tour of the intensive care unit if I want to before, so that's again something you might want to ask your hospital. Could you take a tour of the wards? Could you see the ICU just to get to know where everything is? But I will be in intensive care for about 4 to 5 days, and then I'll spend about a week to 2 weeks in the hospital. Usually they hope people can leave the hospital after a week. You don't return home. you go into rehabilitation. So here they have a rehabilitation clinic in Davos, which is in the Swiss Alps. It's a very nice area. I'm going in a few weeks skiing with some friends. I say skiing, I'm going to go and attempt to ski and then probably cry and fall down a mountain. But yeah, so there's rehabilitation for 2 to 3 weeks after, so you're taught how to cook, how to look after your new liver, how to really protect yourself against infection, so things like when you should wear a medical mask in public, when you can get away with not, how to really look after yourself. Again, the dietary requirements. So I was told after, it's kind of the same diet that a pregnant woman has to follow. So obviously no alcohol, which you've got liver disease, there shouldn't be alcohol anyway. No raw meat, so goodbye rare steak, my favourite. Goodbye sushi, raw fish, another favourite. No raw milk products, raw eggs, anything like that, or unpasteurised dairy products. One of the things, oddly, that they allow, and I assume it's because it's Switzerland, is they do allow, after the initial period, you're allowed to have mouldy cheese, so like blue cheese, which you're not allowed in pregnancy. And I just thought it was funny because, you know, it's Switzerland, and of course if they're going to relax the rules, it'll be around the cheese. But I think every transplant centre has their own set of guidance, which are normally quite similar, but there may be 1 or 2 things your doctor wants you to follow. So they will talk you through all of that. The other thing they talked to me about was the medication after. So if you go on my Instagram, again I'll link my Instagram, a little while ago I posted a picture of all the different medications that I have to take, and there's a lot. And I went through in, I think, my second video, the different types of medication. And after transplant I asked them what kind of medications I'll take, and apparently, again, in every different transplant population, so who's in each clinic, there's a slightly different regimen that you're asked to follow. So a lot of transplant centres will have you on corticosteroids for the rest of your life. For me, this would be not so great because I get steroidal diabetes. Thankfully, it's resolved for me at the moment. But the moment I went back on steroids, I would have diabetes again. And then you take immunosuppressants and anything else you require. So what they try and do in Switzerland or in Zurich, they try and get you on just your immunosuppressant. So they actually only give you IV prednisone, so the corticosteroid, in the intensive care for 2 to 3 days. And sorry, I'm looking down and up because I'm reading my notes and everything. And then you're just on cortisone, so the prednisone or prednisolone, whatever it's marketed under in your country, the tablets, for 3 months. And this is different to a lot of transplant centres. So they take you off the steroids after 3 months, which is great because I don't want to be on steroids. I think obviously they'll put you back on them if you're not doing so great. And then you would have an immunosuppressive drug. And the first line in Zurich is called tacrolimus, which I have heard of, and the second line is cyclosporin. And I did take cyclosporin previously and I really didn't get on well with it, so I hope the tacrolimus would work for me, but that would be their first drug of choice for me. In the first few days I would have blood drawn every day, pre-dose and afternoon post-dose, so the trial level, so the lowest concentration in your blood before you take the next dose, and it starts to go back up. So you would have 2 blood tests at first, and then I'd have frequent visits after transplant, and that would be on a kind of case basis, so how they think I'm doing, if I need more monitoring, if I do really well, and I go to standard. So yeah, that's it. And the other thing, the last thing, is that I know this because I've been on immunosuppressants to try and manage AAH, but immunosuppression comes with a risk of skin cancer. And so for the rest of my life, I'll have to wear factor 50 daily on any exposed skin. I cannot sit in the sun anymore, so I don't like the sun anyway. I mean, I love the sun, but I don't like to sit in direct sunlight. But if you're a bit of a sun worshipper, then this would obviously be a big change for you. But you have to stay in the shade on the beach or anything like that and try and stay out of direct sunlight and cover your skin. So that was most of the information they went through. So I'm going to finish the video here. If you could leave me a comment and just let me know if these videos are any good. I know it's just kind of story time the whole time, it's just me talking, and I hope that it's not too boring, and that for people who I intended this for, so other people in the same situation or family and friends, I hope you're getting out what I hope I wanted you to. So being able to stick to be able to understand where I am in my journey, what's going on, without me having to update everyone at the same time, and also some information for people who may be in the same or a similar situation. So please, you know, like the video. I know I always ask and it just seems like vanity, but it really does let me know if these are okay. I know there are things to improve on, but a little bit of encouragement would be great. So thank you very much, and as always, have a lovely rest of the day, evening, weekend, whenever you're watching this. So bye for now, and see you soon, hopefully sooner than last time.